and I do hope that you are all well. And today, together with the Minister of Health, Pak Budi Sadikin, we will be sharing with you the latest update of policies taken by the government and progress of their implementation in our fight against COVID-19. And before I give the screen to Pak Budi, I will just briefly highlight a number of points. My first point is on the global pandemic situation. The Director General of WHO recently said that we are in a dangerous period of the pandemic. No country has yet won the battle against COVID-19. We are seeing surge of cases and death, especially in parts of Africa, Asia, and Latin America, resulting from the new variant. This trend can also be observed in countries that have managed to suppress the number of cases and deaths over the past few weeks, including in Indonesia. My second issue is the government efforts to secure vaccine. Since the early month of the pandemic, I think you all observed that Indonesia is among few countries which try to secure vaccine for our people. Therefore, more than 100 million doses of vaccine has been secured up to now. To be more exact, Indonesia has secured and received 119,735,200 doses of vaccine. I repeat, 119,735,200 doses of vaccine, both from bilateral procurement as well as from bilateral and multilateral cooperation. Let me give you the details. Indonesia has procured 108.5 million doses of Sinovac vaccine, that is bulk vaccine, most of them bulk vaccine, and 1.5 million doses of Sinopharm vaccine. We received 8,236,800 doses of AstraZeneca vaccine from COVAX facility. So this is from the multilateral cooperation. I repeat the figure, 8,236,800 doses of AstraZeneca vaccine from COVAX facility. We received 998,400 doses of AstraZeneca vaccine from Japan. So this is dosage sharing, bilateral dosage sharing from Japan. 998,400 doses AstraZeneca. And we had also received 500,000 doses of Sinopharm vaccine from the UAE. With the vaccine that Indonesia has been secured so far, Indonesia is able to vaccinate more than 49,618,000 doses of vaccine, 498,180,000 doses of vaccine. And this is the fourth largest doses of vaccination in Asia. We are still working very hard to get more vaccine. The president had mentioned in many occasions on the need to expedite vaccination. In the coming days, Indonesia will be receiving more than 3 million Moderna vaccine from the United States. And this will be the first shipment And there will be the second shipment as well from the US. And this is part of doses sharing mechanism through COVAX facility by the US. On top of that, more than 1.1 million AstraZeneca vaccine will be also arriving soon from Japan. So from Japan, this is the second shipment after the first one of 998,400 doses that I had mentioned before. So again, from US, from Japan, that is the doses sharing mechanism that we use. This month, July, we also expect to receive more COVID-19 vaccine, both from procurement as well as through doses sharing mechanism. Among others, from Australia, Japan I had mentioned, US I had mentioned, the Netherlands, the United Kingdom, and the UAE, as well as from COVAX facility. So I think it's very clear that this month we expect another arrival of vaccine, both from the procurement as well as from the doses sharing mechanism, both via bilateral as well as multilateral cooperation. Of course, colleagues, this is not an easy endeavor due to supply and manufacturing constraint, as well as some restriction that still be adopted, that's still being adopted by a number of countries. And we all know that cooperation and collaboration are keys for the world to exit from this pandemic. My third and my last point is touch a bit on the international cooperation through COVAX facility. As you know, colleagues, I'm one of the co-chairs of the COVAX Advanced Market Commitment or AMC Engagement Group, or in short, the AMC Group, together with the Minister of Health of Ethiopia and the Minister of International Development of Canada. This is part of the Indonesian responsibility to the world. 2 meetings has been done. That was on the 27th of January and 17th of March. And now we are preparing the third meeting on the 12th July. The engagement group is established to facilitate the work of COVAX AMC. And since the first doses began rolling out to countries in February, significant progress has been made on delivery of COVID vaccine. And regardless delays and challenges, COVAX has shipped more than 93 million doses of vaccine to 133 participants, 81 of which are members of the AMC. The member of the AMC is 92. And over 528 million doses have been committed to COVAX by donors through doses sharing mechanism. So through COVAX, once again, 93 million doses of vaccine have been shipped to 133 participants, 81 of which are members of the AMC, and over 528 million doses have been committed through doses sharing mechanism. And this is an important gesture of solidarity and must be replicated. Again, cooperation and collaboration are keys for the world to recover from the pandemic together. And going forward, there are a number of ways we can support the equitable access of vaccine for all, including by diversifying vaccine production, especially to developing countries, and then supporting TRIPS waiver negotiation in the WTO, which is Indonesia is one of the co-sponsors, and expanding COVAX vaccine portfolio. So, colleague, that is all from me, and now allow me to invite Minister Budi Gunadisadikin to speak more details on our response against recent situation in Indonesia. Pak Budi, dipersilahkan.
Thank you, Ibu Ratno, and also my dearest journalists, foreign journalists. Let me share with you the current update on the handling of this pandemic. When I was appointed by the President late last year, I was given 3 tasks. The first one is to accelerate the vaccination program. The second task is to overcome this pandemic. And the third task is to reform the Indonesian health systems. So this is actually my second task given by the President. And we study for every pandemic that hit the world since the early ages. The objective is to reduce the transmission rate. Whatever pandemic happened to human being in the early ages, we always successfully overcome this pandemic by controlling the transmission rate and change this pandemic to become epidemic, which is the transmission rate is under control, and also at the particular time, the number of people that need hospital treatment is also under the capacity of our hospitals. So WHO has also given a guidelines on how to handle this pandemic. Those are 4 strategies that we need to follow. The first one is related with the health systems, especially the health protocols. So every pandemic, starting from Spanish flu, the Black Death, even HIV, the human being need to change the behavior. That is a standard health protocols that you have to follow. And for this time, we need to keep wearing masks, wash your hand, also keep a distance. And these strategies are outside of the scope of the Ministry of Health. We work with BNPB and also other ministry to enforce these new health protocols. The other 3 strategies become the responsibility of the Ministry of Health is detections, vaccination, and therapeutics or treatment. Detection is something that we learned about testing, tracing, and treatment. That including the whole genome sequencing to identify what are the new mutations of the virus. These are the responsibility for the Ministry of Health. We need to execute these strategies. The second strategy that also the responsibility of Ministry of Health is to do vaccination that I will explain to you later on. And the last one is therapeutics or treatment. When you got sick, then you have to be treated in hospital. You need medical doctors and nurses. You need hospital bed. You need instrument, medical instrument, and you also need medicine. For your information, 3 of these strategies are aimed for healthy people. The health protocols, detection, and vaccination is 3 strategies out of 4 from WHO that is aimed for healthy people. The last strategies are aimed for the sick people when you got hit and you're sick. So on the next slide, I will start sharing with you, next slide, on the way we are monitoring the pandemic at the national level. We are following the WHO guidelines that we have to monitor 6 indicators separate in 2 groups. The first 3 indicators are under the transmission level group, and the other three indicators are under the response capacity group. So transmission level is the reality, what happened in the real case. Capacity is how ready we are in responding to a certain transmission level. Those are three items which WHO recommend for us to control. One is the number of confirmed cases per 100,000 population per day. And then second indicator are number of people get hospitalized for every 100,000 people. And also the third indicator is the mortality for every 100,000 people. Let's follow the logic. When you get sick, 80% will stay at home, 20% go to the hospital. So we need to measure the hospital decisions. And then for 20% that goes to the hospital, around 1.7 or 1.6% pass away. So you can see that the three indicators follow the logic. Number of people got hit, number of people goes into hospital, and number of people pass away. The second group on the response capacity is testing the capacity of the system, of the healthcare system for every country, for every provinces or every cities in responding to a certain transmission level. The measurements are based on testing capacity, which is measured by positivity rate, tracing capacity, number of contact per confirmed case, and treatment, the availability of the hospital beds. So these three indicators are used to monitor the capacity of our healthcare systems to respond for a certain transmission level. Next slide. These are the indicators used by WHO to differentiate between level for each of the indicators, whether the transmission level indicators or the response capacity indicators, just for your information. And then on the next slide, we can see that we use this indicator for the national level. So we track this on day-to-day basis, and we have the similar indicator for every provinces, 34 provinces in Indonesia, and also every cities and regencies. We have 514 cities and regencies. We have a daily report on these indicators. Next slide. Next slide. This is an example of the indicators at the provincial level for confirmed case. So we monitor on daily basis for every provinces, which one are level 4, level 3, level 2, and level 1. So this will be used to design the intervention program for every provinces. As you can see, level 4, which is the most severe provinces, are now identified in Jakarta, in West Papua, in Yogyakarta. These are the provinces that we need to design a special intervention program to make sure that we can control the transmission rate. And next slide, and we have the same thing for every cities. If we put it on the map, we can identify by colors which are the provinces that need the intervention quickly. And next slide. We also measure the other indicators, which is the positivity rate. It is related with number of testing. WHO has a standard that you need to test one people, or you need to do one test for every 1,000 people for every week. And many governors and head of provinces, cities, and regencies in Indonesia use that numbers. I explained to them, but that number is only valid if your positivity rate is 5% or below. Positivity rate describes how bad your transmission level is. So if your positivity rate is high, that means that the transmission of the virus in your region, whether it is provinces, whether it is cities or regencies, are really high. So you need to do even more than WHO standard. WHO standard, one test every 1,000 people every week is given for this positivity rate below 5%. So in Indonesia now, because of the Delta mutations, the positivity rate is become very, very high. That's why we need to do even more testing above the WHO standard. And on the next slide, we have set a new standard of testing. So for every cities and regencies that the positivity rate is above 25%, we need to do 15 tests for every 1,000 population every week. And it goes down all the way. So the standard WHO for one test for every 1,000 people per week is only for provinces, cities or regencies that the positivity rate is below 5%. Next slide. I give you example on these are the target given for each of the cities if the positivity rate is high. So we give them the target and then they need to achieve the target. For your information, when I joined as the Minister of Health, by the end of 2020, the number of testing that we did is around 30,000 to 40,000 tests per day. Now, for your information, we are doing around 200,000 tests per day. And we are planning to increase that tests per day to around 400,000 tests per day. Next slide. On the testing or diagnostic strategy, it is also very important for us to identify the mutations of the virus. And when I came in December 23rd, I realized that there is no other mutation in Indonesia rather than the Chinese original Wuhan mutations. At that time, I'm quite surprised because when I checked with my neighbors in Singapore, Malaysia, Brunei, the Philippines, Papua New Guinea, and also Australia, they already have the new mutations. So when I questioned the team why it is not there, then I realized that the number of genome sequencing, it is a very technical terms to do intelligence, to do testing whether the virus type is the new mutation or the old mutation is only done 420 genome sequencing tests for the last 9 months, from March 2020 until December 2020. If I compare with Singapore, they do 2,000 tests, genome sequencing tests. If I compare to UK, they did 20,000 genome sequencing tests. So then I realized that we need to do more genome sequencing for the population of Indonesia rather than only, 120 tests for the last 9 months. So what we did, we established a network of lab which is under the Ministry of Health and the Ministry of Research and Technology to do more genome sequencing. And by now, we already did more than 3,000 genome sequencing tests in the last 6 months. Compared to the last 9 months in 2020, we only did around 140 tests. And then surprisingly, we got all the new mutations. And for the Delta mutation, we have identified first in the March 2021 that it enters Indonesia back in January, the end of January 2021. And then we follow the spread of these new mutations based on our genome sequencing. Next slide. And then we identify yang ada itunya provinces by provinces nggak ada ya. We identified that have been spread for more than 6 provinces. There have been identified more than 8 provinces, 7 provinces in Java and Bali, and another 2 provinces in Sumatra and Kalimantan. So that is where we are quite worried about the spread of the Delta virus because the transmission level is higher. We also realize that the genome sequencing test is expensive and difficult. Only 12 labs in Indonesia that can do this. So last week, we did talk with the Indonesian epidemiologists and identified the new mechanism, a simpler mechanism to identify whether the Delta mutation is already spread over a certain region by looking at the city value level. This is the research done by the UK government, whereas they compare the profile of the city value for the alpha mutation, which is majority in the UK, and then the delta mutation, which is majority in India. As you can see, the difference, the clear difference between alpha and delta is that the city level of delta is much lower. So if you, this next slide, if you can see, oh, this is a slide what I'm thinking. Yeah. So we identify, although it's very small, you can see there is a Greek character in the middle of the chart. It shows alpha, delta, and whatever mutation it is. And we identify the red or the pink color is the provinces that most likely already has a delta variant mutations. So we need to do different type of intervention into the provinces. On the next slide, you can see since the next slide, the genome sequencing is difficult, we use the approach by observing the city level. At the first row, you can see the average minimum city values for non-delta mutation is around 12. If you go to the lowest row, the average minimum city values for Jakarta, Kudus, Bangkalan, which is all mostly delta, is around 9, below 10. So this indicator can be used as a proxy whether in certain provinces the delta mutation is already there or not. And we use this example is West Sumatra. West Sumatra, last week of June, the average minimum city value is 8. So if you remember, in the beginning of this pandemic, if you got hit, you went for PCR test, the city value will be around 17 to 20s. But now when you test, your PCR test city value can go low teens and even below 10. So that is a strong indicator that this is a delta variant. Next slide. This is just take a look at the right hand side of the chart. You can see that before December, in West Sumatra, 38.7% of the city value is above 20. So most of the city value is above 20. Yeah. So only a small portion below 20. But now in West Sumatra, the city value below 20 is already 63.6%. It's a very close resemblance of the city value of the Delta provinces like Jakarta and Bandung, which is 81.2% of all PCR tests have a city value above 20. So this proxy can be used to identify quicker whether a certain provinces, city, and or regencies have a potential Delta variants. Next slide. Now we move to hospital services. This is when every one of you are questioning. We also monitor this using WHO indicators. We identify in which provinces in Indonesia we have a very big pressure on our hospital services. Next slide. And this is on if we see this on a map level. Next slide. Just to share with you, Indonesia has around 400,000 hospital beds. Before Lebaran, we allocate 75,000 of those 400,000 for COVID isolation bed, and only 23,000 were being used. So only 23,000 patients using 75,000 isolation bed from our total 400,000 bed. So we believe that we have enough beds. However, in the last 6 weeks, the number of patients increased from 23,000 to 86,000. It went very, very fast. And again, it is much faster than the previous wave, and it is because of the Delta mutations. We are still having rooms because again, out of 400,000 beds, I have instructed in February this year that 30% or 120,000 is being prepared dedicatedly for COVID-19. So we still have room to reach 120,000. But I didn't like the pace of increase of the number of patients. Next slide. This shows when the bed occupancy rate is high, it doesn't mean that the end of the world. Because as you can see, example in Yogyakarta, whereas the bed occupancy rate is 91%, however, Yogyakarta still have 2,242 for bed, and only, Yogyakarta has around 8,000 beds, and only 2,000 beds is allocated for COVID. So the 90% bed occupancy ratio is used based on this 2,000 COVID bed. Actually, they can increase easily to 3,000 and 4,000 bed by converting the normal traditional bed into COVID bed. So when you see the high bed occupancy numbers, you need to dig deeper to understand how many beds are available, not only by seeing the numbers. The percentage numbers can give you a wrong perceptions, can give you a bad perception and it is wrong. Next slide. So we actually can convert and we still have room to convert. I give you an example. In Jakarta, we convert Rumah Sakit Fatmawati, Persahabatan, and Sulianti Saroso fully for COVID. We understand Jakarta is already more than 50% conversion. It is under stress. That's why we are preparing Wisma Haji with a capacity of 900 beds that will open starting for tomorrow. Next slide. This is an example of what we did, and it will be open tomorrow. It's already being launched by the president. As you remember also, for 100 people got COVID, only 20% need bed. 80% can have a normal isolation, whether at home or a central isolation unit, and hopefully they will recover by themselves in the next 14 or 15 days. So it is also, we need to educate our people that when you get test and positive, as long as three conditions, as long as your saturation rate is above 94%, number two, you don't have sesak napas, difficult in breathing, and also number three, you don't have comorbidity, then you can stay at home, do an individual isolations, because it will protect you for a high viral load that is available in the hospitals. By doing that, you also reduce the pressure to the hospitals and let the hospital to be used by the people that really need, which is the saturation level is below 94%, they have difficulty in breathing, or they have comorbidity. The issue is the people that got sick or got a positive PCR test sometimes get nervous because they don't understand what to do. That's why we signed an agreement with 11 telemedicine platforms. Most of them are startup companies. So all of these people, as long as they get PCR test positive, they will be, we will send them WhatsApp messages where they can contact the telemedicine services and get free consultation services and free medicine. This pilot project was launched 3 days ago for DKI Jakarta only. If we are successful in doing this, then we will replicate to other big cities. Next slide. And the last one, we would like to talk about vaccination programs. Next slide. We have successfully vaccinated 48 million doses for 35 million Indonesians. out of 181.5 million target above 18, which is around 18% of the target. For your information, our first 10 million was achieved in 8 weeks. Second 10 million achieved in 4 weeks. And the last, 8 million, 10 millions mark we achieved in 2 weeks. So hopefully in the future, we can vaccinate faster and multiplications of every 10 million can be done in a week or less. For your information, in the last 3 days, we have done vaccination always above 1 million jabs per day. That also happened last week, and our biggest jabs per day was 1.5 million a day. That is when Pak Jokowi asked us for the first time to reach above 1 million. And thanks to the help of the police and the army, now we are consistently vaccinate more than 1 million people per day. Next slide. This is also to update you on the availability of the vaccine, because the number of doses that we be able to vaccinate depends exactly on the number of vaccine available. So this month, 33 million doses of vaccine will be available. Next month will be 45 million, and the highest will be on October, 85 million doses of vaccine will be available. So if we notice that increases, then we need to vaccinate more than 2.5 millions per day on October. But for July, we can only do around 1 million doses per day because the number of vaccine doses that we will receive is 33 million. And this vaccine will come from many sources. As you can see, Sinovac will be one. We will have 50 million doses of Novavax. We will have 50 million of Pfizer that we will start coming on August. And we will have, AstraZeneca also 50 million. On top of that, we will receive, thanks to Ibu Retno, 100 million doses free vaccine from multilateral agencies like COVAX, Gavi, the grant from United States, Australia, or Japan. And mostly will come either Moderna, Pfizer, or AstraZeneca. So we have mixed type of vaccine. And hopefully by the end of this year, we will reach 441 million doses of vaccine, which is more than enough to vaccinate 181.5 million Indonesian people. Next slide. Just to give you an example, some of our provinces actually have higher first dose vaccination than several states in the United States. You can take a look at One World in data, and you can notice that some of the United States state is only below 50% first dose of vaccine. Bali is closing to 80%. Jakarta is 63% first dose. Yeah. Riau is 54% and Yogyakarta is 33%. Next slide. Now I realize that, even the virus has intercept our internet. They replicate so fast. They are not only transmit by droplets, but also by internet. But anyway, so what I would like, this is the last topic that I would like to share with you about vaccinations. We understand that this pandemic, you need consistent vaccinations. So we need also to build internally the capacity for our local vaccine program. And we have 6 that we are promoting. And 2 of them are moving ahead faster than the others. The first one is the research program done by Lembaga Eijkman, work with Bio Farma, and the second one is University of Erlangga, work with Biotis. And of course, with the help of Ibu Menlu, we are participating in a WTO TRIPS waiver program where we are promoting for the patent for the RNA vaccine to be open for everyone so we can build a factory here in the country. And we don't need the money because we have secured 2 trillion rupiah investment for Bio Farma and the group to build either a factor-based vaccine factory or a nucleic acid-based vaccine factory like AstraZeneca, Moderna, or Pfizer. So as long as we can get the free patent under WTO TRIPS waiver agreement that Ibu Retno is sharing with you, then hopefully we can build the vaccine in the country. So I remember a quote, when the wind of change are coming, many tribes will build walls, but only a small, smart tribe will build windmills. So when this pandemic happens, we believe we don't only see this as a danger, but also an opportunity for Indonesia as a nation to build a much stronger systems, healthcare system, and healthcare resiliency for the future. When the virus SARS-CoV-2 came now, 17 years after the SARS-CoV-1 hit China, then we cannot predict whether the SARS-CoV-3 and SARS-CoV-4 will come. So it's our job, it is our responsibility to make sure that the next Indonesian generations, the children of our children, will be much more ready than we are when the next wave of pandemic is coming. Thank you.
Well, thank you very much, Pak Budi. Thank you very much, colleague. I think we had listened very detailed information from Pak Budi. If I can summarize or the takeaways from this meeting, one is that we know every country is facing huge challenges right now. The ups and downs will remain be there. And I think we are still not out of the wood yet, at least in the near future. And from Pak Budi explanation, the government of Indonesia, it's very clear that the government of Indonesia is, and will spare no efforts to manage the pandemic. And again, vaccination is one of the keys. On the vaccination, Pak Budi, I think we have to check again the data of the doses that we have injected. My data is 49, your data is more than 48. I think there is a slight difference. And then colleagues, the team of Pak Budi will give you the latest, the last figure, how many doses of vaccination that we have injected to the people. So once again, vaccination is one of the keys. The other one is necessary measures and policy to flatten the number of cases. So necessary measures and policy have to be taken to flatten the number of cases. And you observe that the government have imposed stricter control of people movement, and hopefully this measure can prevent the spread of the virus. And we do hope to see a decline of cases in the very near future, inshallah. The key for the policies and the measure is the implementation. So implementation of the measures will be closely monitored to ensure its effectivity. So colleagues, inshallah, we will be able to, together we will be able to manage this pandemic. Cooperation, collaboration are key from within and with other, with the international, with other countries. So with that, I have to stop the press briefing for tonight. And for all of you, stay well, stay healthy. Terima kasih Pak Budi dan teman-teman yang sudah mengatur acara ini. Teman-teman media, sekali lagi terima kasih dan selamat malam. Pak Budi, masih ada yang mau disampaikan?
Ibu Retno is correct. My data is yesterday. Ibu Retno is more recent, 49 million, Ibu. And to my surprise, I just checked now, is 51 million, Bu.
All right, it's even higher.
So even in every minute, every hours counts. It shows that both of us are working extremely hard, to accelerate the vaccination program, Bu. Just on my side, Bu.
All right, thank you. So let us be optimistic. Insya Allah kita akan bisa. Terima kasih teman-teman, terima kasih Pak Budi. Thank you very much, colleagues. Good night.
Thank you, Ibu.
Belum maghrib.